Would you state your name, please?
Richard Sackler.
How much money has Purdue Frederick or Purdue Pharma made off the sale of OxyContin?
I don't know.
Okay. Do you know how much the Sackler family has made off the sale of OxyContin?
I don't know.
But fair to say it's over $1 billion.
It would be fair to say that, yes.
Do you know if it's over $10 billion?
I don't think so.
You know if it's over $5 billion?
I don't know.
All right. Again, it's Cornelia Hinch. It's dated May 29th, 1999. It says, if you'll read the highlighted portion, it says, this is an email from you to her, correct?
Yes?
It says, you won't believe how committed I am to make OxyContin a huge success. It is almost that I dedicated my life to it. After the initial launch phase, I will have to catch up with my private life again. Did I read that correctly?
You did.
When you say you dedicated your life to it and that you have no time for your private life, what were your day-to-day activities with respect to OxyContin?
May I read the whole document? I haven't seen this for 16 years.
Have you read your deposition in the Endo litigation?
No. In preparation for this?
Yes.
No. The context of this was to encourage Dr. Hench, who was the head of the Australian business and was meeting with great success with MS Contin, to pay perhaps more attention than I thought she was paying to the prospects or potential for OxyContin. And so this was in the spirit of motivating her. It was true that I was very gladdened to see that OxyContin was meeting with such a strong positive reception by both physicians and patients. And I was working hard at the business, but if you would misinterpret this if you thought that I was working only on OxyContin. That was not the case.
Okay. When you say you were encouraged by the number of physicians that were selling it,
Prescribing it,
you were not aware at this time, were you, or were you aware that your company was committing a felony in how they were marketing and branding the drug?
I object to the form of the question.
I was not aware at all of what you're saying. And when I say I was heartened by physicians' reception, when I did speak to physicians at meetings, I didn't go on sales calls, but at some meetings and conferences, they were extremely enthusiastic about the effectiveness and the safety and the reception their patients had, response they had to the product.
Okay.
That was what I was referring to. Because, as I had told you before, our goal was to make a better product than MS Contin. And I believe this was one of the ratifications of that.
Let's mark this exhibit 3. The way the sales scheme was set up, if they sold more OxyContin, they made more money, basically.
Yes, the same as almost every other company in the industry.
And then you all gave your reps an additional incentive because you decentivized them to sell MS Contin, but you increased the incentive for selling OxyContin. Is that true?
Yes.
And then you had one of the highest paid sales forces in the country. Is that accurate?
I've heard that said for 1 or 2 years. It certainly wasn't the case or hasn't been the case during the history of OxyContin.
Do you know if reps that promoted and sold OxyContin sometimes ended up making over $250,000 a year?
I've heard that that was the case. I'm sure it was unusual.
And then your top sellers were rewarded with trips to Bermuda or London in what was called the Toppers program. Is that correct?
Yes.
And during the first 5 years of OxyContin's release, Purdue more than doubled the size of its sales force, correct?
And that's correct.
So let's look at page 2, the last paragraph. It says, our meeting ended with a question and comment period. Michael Friedman emphasized the threat that AB-rated generics pose to MS Contin. We're not sure when AB-rated generics will be launched, but we don't think it will be until 1996. Inevitably, AB-rated generics will arrive, and this is why it is of extreme timely importance that we must establish OxyContin. OxyContin can cure the vulnerability of the AB-rated generic threat, and that is why it is so crucial that we devote our fullest efforts now to a successful launch of OxyContin. Did I read that correctly?
You did.
And who is Lydia Johnson?
I don't know.
This department, it looks like it's the marketing department. Is that right?
I just see a distribution list. I don't see a source. I don't know. It says that the department is marketing, but I don't know Lydia Johnson.
Was it your belief that it was of extreme timely importance that OxyContin be established because AB generics were going to arrive and compete with MS Contin?
No. The principal goal was to produce the best product we could, and we believed when we started it, and subsequently. Should I stop?
No, that's.
We believed it was and is a better product than MS Contin.
Okay. Do you believe Purdue's marketing was overly aggressive?
No.
Yeah. Do you believe Purdue's marketing was appropriate?
I believe so.
It says here on page 30, OxyContin's wide availability may have increased opportunities for illicit use.
I'm sorry, what page are you reading
Page
from?
30.
Page 30?
Yes.
30. Okay. Okay, and where should I look?
Last paragraph.
Okay,
The
thank you.
large amount of OxyContin available in the marketplace may have increased opportunities for abuse and diversion. Both DEA and Purdue have stated that an increase in a drug's availability in the marketplace may be a factor that attracts interest by those who abuse and divert drugs. OxyContin, if you go on down, OxyContin became the top-selling name-brand narcotic pain reliever in 2001. Is that accurate?
I don't know, but I just don't know.
With respect to oxycodone and morphine, do you know whether OxyContin is more powerful or less powerful a drug than morphine?
It depends what you mean by powerful. If powerful means potency, absolutely. It is twice as potent as morphine. And we were very proud that we discovered this, first in animal studies and then in human studies, and we made it widely known, perhaps even before the drug was introduced, but certainly in the package insert and all the promotional material.
Did you think that if physicians thought it was stronger or equal to morphine, much less twice as strong as morphine, that they would be less likely to write prescriptions and sales of OxyContin would go down?
No. If its personality was changed, if it was stigmatized as an end-of-life drug, it could limit its usefulness. The term stronger here meant more threatening, more frightening. There is no way that this intended or had the effect of causing physicians to overlook the fact that it was twice as potent. It was called out in virtually every promotional piece of literature. It was reflected in a conversion chart, which we had developed for the few patients who were being treated with morphine, where we made it very clear if they're on any dose, daily dose of morphine, you cut that dose in half for OxyContin.
It says, very at the bottom, less potential abuse than other opioids. Do you know where that claim came from?
I don't know. I'm looking at, is this after the package insert? No, no. No, it's before the package insert was approved. I don't know.
Do you know whether OxyContin had less potential abuse than other opioids?
I don't know what this refers to.
He says, since oxycodone is perceived as being a weaker opioid than morphine, it has resulted in OxyContin being used much earlier for non-cancer pain. Physicians are positioning this product where Percocet, hydrocodone, and Tylenol with codeine have been traditionally used. So he's saying here, physicians are using it because they think it's weaker than morphine, correct?
He's using the word weaker, but not meaning less potent than morphine. At this time, it appears that people had fallen into a habit of signifying less frightening, less threatening, more patient acceptable as under the rubric of weaker, or more frightening, less acceptable, and less desirable under the rubric or word stronger. But we knew that the word weaker did not mean less potent. We knew that the word stronger did not mean more potent. And we knew that because by this time, surely, anybody who was using this product recognized it was more potent. They knew it was more potent. So it's very unfortunate for your understanding, as well as anybody else's understanding, that all those issues of the stigma of morphine, of the frightening nature of morphine being a cancer drug, end-of-life drug, it's a very unfortunate for your understanding and for most people's understanding that the word weaker and stronger was used.
Yeah,
but we understood what it meant.
We're not done reading it yet, but let me ask you
Okay.
this. You were advised by your senior employees that physicians perceived OxyContin controlled release as less strong than morphine. Many physicians perceived it that way. Correct?
Words used, but didn't mean that they believed it was less potent, because I knew they believed it was more potent. Their own practice proved that they recognized it was more potent. As I said before, Percocet was 5 milligrams.
Did you do any studies yourself or conduct any investigation to determine what percentage of physicians believed that OxyContin controlled release was less powerful than morphine and were not aware it was twice as strong as morphine?
You're talking about less potent.
Yes.
I don't know of such studies, but in common parlance, in discussions with physicians, if really a substantial, if any substantial number of them had an erroneous belief, if any held an erroneous belief and said to a representative, oh, this stuff is less potent than morphine, the salesman had ample materials to demonstrate to the physician that he was in error and was instructed to use those and did use it. And I wish we had done a survey to demonstrate it in retrospect, but it was so generally accepted that it was at least 1.5 times more potent by even the skeptics, most skeptics, and there weren't many, but generally recognized to be twice as potent as morphine. It just never occurred to us.
Sure, and it's your belief that your sales force was telling these physicians that it's actually twice as strong as morphine and correcting that misperception that they had?
Absolutely.
OxyContin was brought to NDA. What's NDA?
To NDA filing, that's the filing of the new drug application.
Right. From early phase 1 work on time and in an incredibly compressed period of 2 years' time. That's because an NDA usually takes longer, correct?
Well,
and let me just preface it with the reason it takes longer is because there's a number of studies that have to be done, both animal and human, to determine if a drug is safe and efficacious, correct?
right. In general, that's correct.
But in this case, you all got it done in an incredibly compressed period of time of 2 years. Robert Reeder set the goal in November of '93 to file by December 31st, '95, and we submitted on December 28th, '95, 3 days ahead of schedule. This didn't, quote, just happen. It was a deftly coordinated, planned event that took dozens of worker years of effort to succeed.
True.
The most demanding NDA package for any analgesic product ever submitted didn't languish at the agency. Unlike the years that other filings linger at FDA, this product was approved in 11 months, 14 days. Our previous best approval time for other products was measured in years, not months. Much can be attributed to the unparalleled teamwork of the product team and the FDA's approval team, which came into being as a response of our joint desires to operate within the context of a new time frame. Both we and the pilot drug division of FDA were motivated by the same goal to set the highest standard NDA with the broadest indications approved in the shortest possible time frame. Did I read that correctly?
You did.
Okay.
Did you have any questions about that?
Nope. I just wanted to know if that was the statement you got and is it accurate?
This was I believe it is accurate. I'm certain that the facts in there were accurate. The tone was very upbeat, almost a team enthusiasm building expression. I believe the facts are correct. And I don't regret trying to energize our sales force. I think that was my mission. But this isn't what I would have written if a board had been, or said if the board had been there. I wouldn't have been, the tone would have been more restrained.
Have you seen this agreed statement of facts before?
Before today, yes.
Yes. Did you provide comments on this document?
No, I did not.
Were you surprised by any of the allegations in the document?
I didn't read the whole document. So I can't say if there are allegations that would surprise me. I had understood that this was a settlement document and that people in the company who'd investigated thoroughly said to the board that the statements in the document were true.
Okay. And when you say I didn't read the document, as we sit here today, have you ever read the entire document?
No.
At the time this was signed in May 7th and 8th of 2007, what was your position in the company?
I was a director of the company.
Here's Ellen Ballard in Louisville, Kentucky, sales rep Mark Curran. Do you know who that is?
No.
And in here it says, talked of less euphoria and more convoltol with oxy. Would it be inappropriate to tell patients they get less euphoria with oxy?
We really don't know what was said. As I said, this is a memory jogger. He might have said, there may be less euphoria, or some people have less euphoria, or we just don't know what was said here.
Okay.
If all he said was, there may be less euphoria, that could be true, and I don't see the harm. If he promised less euphoria, it shouldn't have been said.
An agreed statement of facts doesn't say you have to promise less euphoria. It says if you mention to a doctor or infer that it causes less euphoria, that's improper, correct?
That was what we agreed to, yes. But this was 1998, long before there was an agreed statement of facts.
What difference does that make? If it's improper in 2007, wouldn't it be improper in 1998?
Not necessarily.
Well, the improper conduct at the agreed statement of facts, the time period was 1996 to 2001, correct?
Yes.
And if this is 1998, it's within that time period, correct?
Yes.
Okay. So by what kind of twisted logic are you saying that saying this in 1998 wouldn't be improper because the agreed statement of facts is in 2007?
I object to the form of the question. It isn't a question. It's argumentative, and it's really uncalled for.
If you can answer, go ahead.
I think I should stand on what I said.
Were you aware that certain healthcare providers were being told that they could stop therapy abruptly without experiencing withdrawal symptoms, and that patients who took OxyContin would not develop tolerance to the drug?
No.
Okay, and that statement is false, correct?
No, it's not clear to me it's false, but I am eager not to contend with it. It says certain healthcare providers, and the rest of it is conditioned really in large measure on, in the first case, the dose that the patient is on, and the second case in the duration that the patient is on. But reading between the lines, as I suspect those who shaped this did and understood with the government, I can accept it as being a reasonable expression of improper conduct. That is, certain healthcare providers might have been told regardless of dose or regardless of duration. But had I known about this, I would have alerted our attorneys who are negotiating this that this ought to be a little bit more specific because it's going to be difficult to agree with it the way it's written. But I won't quibble with it.
Well, there was actually a whole lot of back and forth on this document.
There may have been, but it wasn't with me.
Well, let's talk about the number of Purdue entities there are. How many Purdue entities are there?
Don't know.
Okay. I've seen upwards of 69 different corporations, perhaps, that the Sackler family owns. Is that correct?
If you've counted them, I can't differ with you. I don't know the answer.
Okay. There are a number of Purdue entities. The Purdue Frederick Company, Inc., does it still exist?
I don't know.
Okay. Do you know how many current companies are owned by the Sackler family?
No.
Right. Are you still the director of Purdue Pharma, Inc.?
I'm not sure.
Okay. Are you still a general partner of Purdue Pharma, LP?
I am not. It is owned by two trusts.
In July 30th of 2014, were you a director of Purdue Pharma, Inc.?
Not that I'm aware.
This is a affidavit filed in the Southern District of West Virginia. And does that appear to be your name?
That does.
And it's dated July 30th, 2014. It says, Declaration of Dr. Richard S. Sackler. I am a director of Purdue Pharma, Inc., the general partner of Purdue Pharma, LP. I've held this position since 1990.
If that's what it says, then that's what it says.
Okay. Sitting here today, after all you've come to learn as a witness, do you believe Purdue's conduct in marketing and promoting OxyContin in Kentucky caused any of the prescription drug addiction problems now plaguing the Commonwealth?
I don't believe so.
Sitting here today, after all you've come to learn as witness, do you believe that Purdue's conduct in Kentucky has led to an excessive or unnecessary amount of opioids being located throughout the Commonwealth of Kentucky?
I don't believe so.
Do you believe that any of Purdue's conduct has led to an increase in people being addicted in the Commonwealth of Kentucky?
No.